right, I believe we are live. Good afternoon, everyone. It is Friday, February 4th. This is United Medical ACO. We are here, as always, Friday at 2 p.m. I have Sean Dargan with me. Hi, Sean. How are you doing?
I'm doing well, Kemal. How about yourself?
Good. So actually, today we are going to try some new stuff. So hopefully we don't mess it up. Let's see how it goes. So, okay, so now I'm sharing, I'm actually controlling two computers. Since this is a low-cost production, we'll see how that goes. I just want to see how we have it. Yeah, it's ideally it's not okay, let's see. Let me see if I can move things around and yeah, it doesn't move things around. So we'll figure out. So we're trying to put the third virtual background on the bottom of the screen. On my screen it is, but on the live side it's not. So hopefully next time we can figure that out. So so today our topics are going to be around the COVID and Neuralink, and also we have Richa Sabesan, who's going to be our guest. She's going to be joining us for the RCM side of it. So we are going to go ahead and start. So now, as usual, we have a little cartoon to start with, right?
Yep. So here's our cartoon we have featured this week. It is obviously a spin on Groundhog Day here that we just saw not that long ago. The cartoon here is Dr. Fauci coming out, and it's you see the crowd saying we can expect 6 more variants, which actually did just by chance happen to go with the actual groundhog. In fact, seeing his shadow, at least the one in Philadelphia. I know there might be a couple across the nation, but the Philadelphia one did see his shadow. So predicting 6 more weeks of winter. So this actually did happen to coincide with this taking a spin on the 6 more variants for Dr. Fauci there.
Hopefully it's not going to take that long, but it can be quite more than that, but we'll see. We'll see how that's going to go. Now, I am going to actually, again, because we are just trying a couple different things here. For example, right now, I'm not able to share from this computer, so I'm going to just give access to this guy here. Okay, it should be fine. And right, so I'm able to share the screen now. Hoping that I'm sharing the correct screen.
Yep. So right now displayed, we have our COVID-19 case tracking with our numbers. So the United States is drastically lower. If you look at the highlighted part there, we said it was at 613,000 last week, which I believe the week prior, so 2 weeks from this session, in the past, I think it was over in the 750 or 730,000. So now down to 385,000 is super significant drop in overall cases being reported. And actually on the next graph we have a little bit later, we'll actually see the red trend line, which maybe it makes it a little bit easier to see, visualize the peak actually coming down. Yep, so right here, you see the red line is going to follow the trend. And as you can see, the peak was reached right around that New Year's Eve holiday time period. And now as we're almost into almost a full week into February soon, we see the peak obviously coming down with that overall trend line on the decline. And then in regards to the vaccinations, again, up another 7 million, which I know 2 weeks ago it was also experienced a 7 million increase in number. So that's good, 14 million over the last 2 weeks. As you see there, it's enough to have roughly 82.5% of the country's population getting their needed doses. And then down there, just to give us a timeline estimate, at that current rate, it would be almost 120 days to another 10% of the population to receive their vaccinations. And then, as I've been saying, seems pretty consistent. We have that uptrend in the visual graph right there we're looking at. And then for our personal right here in Delaware, just to compare Delaware numbers with the overall country, we have our percentages there on the right-hand side displayed. So overall total population for the USA, we have 75, almost 1.5%, getting their fully vaccinated or at least one dose there. And then Delaware is at 61.2. So you can kind of just see the comparisons there with the overall country and then Delaware, like I said, displayed in the margin. And if we look at the numbers displayed on the left-hand side, we have 212 million people fully vaccinated across the entire country, with over 88.5 million people receiving that booster shot, which we actually will touch on a little bit later, the importance of that booster and what we're kind of seeing statistically with the significance that it brings.
So actually, that is, let's talk about that a little bit, because what we know today is people who are still kind of debating whether or not they should be vaccinated. I think that question, there shouldn't be a question like that anymore. So I just find out my nephew, who's 16, he's apparently he's positive. He had he has his first dose. For whatever reason, he didn't get his second dose in a timely manner. So he's a basketball player, so he had to cancel his first professional game. So he had to come back. So, but from what I see, when I look at this statistic here, so people who are losing their lives unvaccinated is by far its leading population in that group. So, I mean, there is really nothing to say anymore. So if you can compare two numbers together, people who are fully vaccinated, they are safe. So we can easily say that here. But Sean, the other thing that I want to actually talk about is what is like fully vaccinated and when we can go back to normal, or are we ever going to go back to normal? So if we can actually talk about that a little bit.
Yeah, so you know, as we say, it seems that it's been a couple of years now. Everyone wants to know, when are things going to go back to normal, and that kind of seems like a key topic that is influencing, all the progress and procedures kind of that we're seeing, both state by state and also nationwide. As we know, Delaware recently re-implemented the mask mandate with the Omicron virus, with like you see in the graph, the rise of cases at the end of 2021. So we know Delaware re-implemented the mask mandate. So in regards to, going back to normal and, when is it going to be? Obviously, it's never going to be like it was right prior, but as closely as you can get, like you're saying, it's the vaccine, being able to get the booster, that we see that helps against the severity of symptoms. So if you were to actually recontract any of the variants, we know that the symptoms and illness is a lot less severe. And then, as you're saying here, the masks, we mentioned in a couple of our sessions, in our live session as well as our provider meetings, which masks are actually more effective and which ones we see that maybe people shouldn't be relying on as much as opposed to our surgical and our K95 masks for sure.
So I don't think, like, for the winter season, I don't see in the next 5 years without the mask, like us going through the winter season without a mask. And I think that's a good thing. Even for the, even if we didn't have COVID, or elderlies to have masks with the flu season, I think that was that's a must. They should definitely. So, all right. Well, before we were going to talk about our book, which we are going to. Well, actually, let's talk about the book now, so then we can go back to the vaccine issue, because there are a couple other things that's a little bit on the kind of on the edge with the vaccine, and some of the tests, they're kind of concerning, and I think we do need to address those issues. And we need to take a position to see how far this is going to go, because it becomes a public safety issue. But let's actually talk about our book. a little bit. So now this book projects that we've been talking about, this is coming from our I'm sharing the right screen.
Yep. So we have the execution here by Larry Bosby and then Ram Sharan.
Yeah, both devices in front of me, so a little bit disoriented now. So this is part of our United Medical Leadership Retreat project. So this book, actually, I believe it was 5-6 years ago, we have done this with the entire team. So were you able to finish your side of it?
Yeah, so obviously I did my research here and kind of snooping around the book, seeing, the main message behind it, kind of what it wants to get across to its readers, what the main lessons and the approach that the book itself actually took in order to get these messages across. So some of the key parts that I was hitting on here. So I just put up here on the slide for our viewers to see, obviously the title of the book being Execution. So, what is execution? So 2 factors here that are kind of important, underlined in our image here is, being able to get the task or whatever the objective is done the right way and on time, and ensure that it needs to be done just in general. So not only are we just doing a task to say, yeah, it's checked off, but are we doing it the right way to the most efficient possibility that we can? And is it done in a timely manner where we're not kind of dragging tasks or objectives out beyond what is necessary?
So the big struggle that we have is we are trying to actually get things done, right? So I think the reason I do like this book, it's actually kind of, let me actually stop here for a second. So Sean, you, for someone who just finished college, so, and someone who's been out for a long time, so I do get to kind of maybe give you a little bit background information on this. So some of these business books, they're, of course, these writers, they make money. And some of these writers, they're not business people. Now, I'm working on my book, and it's a big project. It's from the real business experiences. And each chapter is representing one of the companies that we created, and either it's a client or one of our own companies. So it's not an easy thing to do, but then you have to have the right things in place. But in terms of the team itself, there are certain elements that you have to have in place. So if you don't have the right behavior, then it's kind of difficult, or right goals, right people, right attitude. So this book actually gives that structure from that point. So when we look at it from the 3 different blocks, and then you did this nice summary here. So we talk about the first building block, which we talk about the 7 essential behavior in a different way, with the 7 efficient habits of successful people. So there's a bunch of things that people need to do. So what's your take on this?
Yeah. So like you said, recent out of college, some of the things I can relate to, obviously, I've not the same experience level as you, having created successful businesses and multiple, but some of the things that I could relate this to, like you said, just coming out of college. So both classwork as a student, and then also the extracurricular, being a student athlete. Like if you look at these 7 things here with the 7 essential behaviors, and if you look at looking through them, a couple of the common underlying things is kind of knowing your audience, knowing your people, knowing your business, obviously the first one there, and setting clear goals and priorities. And I think that is kind of an underlying thing across many different aspects in life, whether it's, like the business, like we said, education, getting a hold of your financial means, or whatever you're trying to improve upon, knowing who you're working with, how to work well with them cohesively, and also what your goal is. Making sure you're setting measurable, attainable goals is definitely a key point here. So I think that there's a lot of underlying things here with these essential behaviors that can be applied to many different aspects in one's life, for sure.
Definitely. And then from here, if we are actually going to the creating an execution culture. So this is actually, I do say, I do repeat culture a lot. And in the business sense, many people do not really understand what culture is. So when it becomes a culture, culture has to be something that's done by everyone in the company. It's not something that just I do it or you do it, but it's done by the team. Like this is United Medical culture. So it has to become part of our DNA. It has to become part of our behavior. So in order for this to happen, so everyone is doing it, and this is the execution culture that we are talking about. And finally, we have the building block 3, if you want to cover this one.
Yeah, so building block 3 was kind of touching on the job that no leader should delegate, having the right people in the right place. So I think, again, that kind of relates back to some of the previous building blocks of knowing your people, knowing who it is that you have on your team, knowing what their strengths are and what their weaknesses are, and how you can kind of optimize what they bring to the table to help in the most productive and efficient manner. So having the right people in the right place. Obviously, sometimes it might take some trial and error. This person's better at this task, but they sometimes struggle being able to communicate this type of idea. So it's kind of sometimes trial and error. But once people start doing certain things enough times, you can kind of see you'll excel in certain areas and others that you may need extra help in. So once people become more productive and more efficient and kind of mini experts in what their area is, it becomes a lot easier for the business as a whole to achieve the goal that they're aiming for. And also part of that is you'll see later on rewarding the doers. So making sure to acknowledge people that are doing above and beyond at a particular task or whatever their initial approach may be to the idea and getting that objective done.
Right. So we are going to ask our next guest to join us, Richa Sabason. Hey, Richa.
Kemal, can you hear me?
Yes, I can hear you. How are you doing?
Good. How are you?
You're not a guest, right? So you are actually you are one of our hosts. So you are the director of RCM. So how are you doing?
I'm good. How about yourself? Thank you for having me.
Thank you for joining us. So today you are in the office. So we are in this new format. So I'm kind of like I was saying earlier, going between. I should take a picture of what I have in front of me. So that's not easy. We should hire someone. Anyhow, so we are going to talk about client feedback and how United Medical actually is dealing with client feedback and why we are doing it, who is actually processing this, what frequency we are talking about it. So I will start sharing the screen and then you can tell me wherever you want me to stop. We can actually stop at that point.
Okay, sounds good.
Yep.
So the basis behind client feedback, right? That I think we should start with what we're trying to achieve by asking certain questions to clients. We want to find out whether they are satisfied, whether we are meeting our goals and their goals. Is communication going well? Are their managers knowledgeable? So these are some of the things we're trying to find out from them. And you know, our overall satisfaction rating, I feel, has always been very strong. On the screen, we have, you know, all of the quarters from 2021 until present. And you can see that we ended the year very strong, you know, 100% rating. And I always like to think, Kemal, I think you probably agree with me. I think people are more inclined usually to write reviews when they're actually upset versus when they are happy. But I think the fact that our, you know, satisfaction ratings are always so positive, I think it's a really great indication of how we're doing as a whole in the company. Because had we not been in that position where we are, you know, giving them what they need, I feel like we would be getting those negative reviews, which people are always ready to put online. Or
I'm probably one of the people who are who's giving the negative reviews.
Yeah, no, I agree. You know, if I have a bad experience at a restaurant or something, I'm the first one to write that negative review. So, you know, this is a good indication that we're doing our jobs to the best of our abilities. So this is our communication question. So we basically ask, are you overall satisfied with how we are communicating to you? Your monthly reports, your updates on insurances. And I think, Kemal, especially since the pandemic started, your evening sessions that you've been conducting, that's a huge part of probably these positive ratings. Helping the providers with navigating the pandemic and what the changes are and what's happening. So I think, these communication reviews are really reflective of us as a whole, company as a whole, just giving everyone what they need. And yeah, we have a perfect score, as you can see.
What they need, but even if they don't need it, when we have that like systematic structure, like, okay, this is happening every Thursday, or it's happening every Monday and Tuesday, like the frequency and just keeping that system in place, that probably just gives that stability, and then they're happier from that point as well. You're right.
Absolutely. And again, another perfect rating. This is our key performance indicator. Now, these are the metrics that we share with the clients every month. I know this may not be something everyone knows about, but it's essentially letting them know how they're doing, both financially on a claims level. We're also giving them information about denials that we are receiving, how they're doing compared to other clients. So we're sharing this information on a monthly basis. We have a goal to discuss this with our clients, or at least send the reports to them before the 15th of the month, because you want to catch what happened in the previous month, within the first couple of weeks of your new month. Otherwise, it becomes too late. We set these goals and we make sure we give the information to the client in a timely manner. So I think that's why our ratings are always really pretty positive on here as well.
Yes, that's excellent. Oops, sorry, I went too far. Okay.
And then these are our manager performances. So we have 3 client managers that are very knowledgeable. We also have 3 senior client managers that are supporting the client managers when clients need assistance or when they need assistance. So as you can see, we have very, very positive reviews for our managers. And not only this question, but we have a comment section on our satisfaction surveys. And there's always, very, very strong feedback from the clients saying how happy they are with their manager, how much knowledge they have, how much support they give them. So, it's really kind of what you guys were talking about on the last segment, is having the right people, in the right places, which I feel like we really do from a management standpoint. And then these are meeting our goals and expectations. Now, this particular question, I think the reason why, our score is not like the other questions, we have things happen from time to time. So whenever you're in a business where you're dealing with insurance companies, a lot of these kind of goals and expectations have to be, altered or changed or re-looked at, because we are always in a position where we're trying to keep up with the insurance companies and what they're doing and how they're paying. So it's just, a lot of the times when we get these reviews, it's because something is going on that month. Something happened that shouldn't have happened, or an insurance company, denied a bunch of claims just erroneously, or they took back a lot of money and we were not notified. So these are things that, we're dealing with now, where I know, 15 years ago in the business, although we were having difficulties with insurances, I don't think it was where we kind of are today. And then this is our payment posting team. So this was actually a newer question that we just added. I think we added it in 2020, like the end of 2020 or so. So we wanted to kind of get feedback on our other department, which is an integral part of our RCM system. Learning the way the system works, everything starts with payment posting. So, we've had some of these reviews that are a little bit, not so positive. And most of the time it's been easy, quick fix, just something that perhaps, we missed, or something that the payment posting department wasn't, aware of. And we've gone ahead and fixed it. And then, the client comes back to us and says, hey, listen, we understand you had an error and thank you for fixing it. So, even still, our rating is quite high. over 94%. So our team is still doing successful regardless of, having those couple of instances where they got negative feedback.
We'll take 95 on that.
Yeah, yeah, absolutely. So those are all of our questions. So, we hope to continue to provide the best level of service that we possibly can and continue to get the best reviews that, that we've been getting all these years.
So I think it's really important to keep the clients happy. And our relationship with our clients is not one-time purchase, one-time interaction. And I think it's easier for some of those when you are buying, let's say, this your interaction with the Apple is you buy it and then you are done with. When it comes to our services, you are buying the service, and some of our clients, they've been with us for about 21 years, 20 years, 19 years, and keeping that going and just making it as efficient as possible. It only happens if we are able to actually have a really good team who really is understanding and not only they are understanding, but they are really committed in the medical billing and revenue cycle management. Otherwise, it's going to be difficult if they don't see this as a really important professional. If they don't have the professional approach, it's going to be very difficult to achieve what we have. And I think that's one of our big strengths is that we are able to do that. And I'm proud of what we are able to do. Well, Richard, thank you so much for joining us. And when you guys are able to come and be part of the meeting, it's always more enjoyable, and it's more beneficial for those who are following us and listening to us. So thank you for being with us.
Absolutely. Thank you, Kemal. Thank you for having me.
All right. So we are going to go back to our Neuralink obsession. But before we go to that, actually, I do want to finish our discussion on, let me see if I can just pull that up. I was just telling Sean earlier that I was going to dump a couple things on him, but I would know what they were. So here is one of them. So let me actually fix this. All right. So Sean, I was able to figure out how to fix the order. So now,
right.
So it should work out now. All right. So what's wrong with Canada?
Yeah. So here we have the truckers actually in the news with their Canadian protests. It's against the vaccine mandate up in Canada. For those who don't know, as they are crossing international line anytime they bring goods into the U.S. or whatever, they are required now to have their vaccine to be entering, obviously, across nation border lines there. So they are actually protesting the vaccine mandate. And actually, for those, obviously, if you've been in tune with us each week, the previous weeks, we've been discussing the lack of goods as we've seen in the grocery stores, supermarkets, and obviously goods being transported across the country between nations obviously rely heavily on truckers. And to have an already shortage in truckers to begin with, now having those who were working in the workforce now being protesting, so you have even less, we might see some pretty big impact that they're having with this protest on, again, these goods and services in these stores that we rely heavily on. Definitely going to be feeling the impact of this here. Yeah, Kemal, if you want to touch on kind of what their protest or their agenda.
They are doing this while I'm trying to actually fix the other issue here. So let's see. All right, is it okay? It's fixed now. So the issue apparently is when they are back, when they are returned, on the return, they have to be quarantined for they have to follow the protocol. Well, get vaccinated.
Save you a lot of time.
No, get vaccinated. I don't know why they are not actually just doing the vaccine if they have time to do what they are doing I think the vaccination would be the answer for them, but I don't really understand. I don't really understand why they wouldn't be. So, okay, now we have other topics. Neuralink. We don't have anything new on Neuralink, but we do have.
For Neuralink specifically, we do not. Obviously, for those who know, Elon Musk also has the company Tesla that he's a part of, amongst others such as PayPal, and we have Neuralink Tesla. There's a whole bunch that he's a part of. So there were some updates in the news with Elon Musk regarding Tesla and kind of where he's focusing maybe some of his time and efforts. Recently coming out in the article here, we have, this is the robot back in August of 21 is when he initially announced the humanoid robot that they were designing, as you see there in the top of the clip there, to eliminate dangerous, repetitive, and boring tasks. So again, as we were kind of mentioning with the truckers and the workforce, the labor shortage there, tying these all in together, kind of, if you had these robots to eliminate some of the more dangerous tasks or repetitive, boring ones, thinking, and in my mind, it just goes to like factory work type, where it's just a repetitive task, like an assembly line, is what I'm picturing. But these humanoid robots that Tesla's coming out with, Elon Musk is saying that he's hoping that he actually devotes more of his time towards that for Tesla specifically, as opposed to creating new car models. Because I know a lot of people, when they think Tesla, they think of the automated driving, full self-driving vehicles, and the surge in popularity that we saw recently with Tesla cars in general. But Tesla also has a lot of artificial intelligence and other parts of their company that's not just automotive focused. So he's saying here that he wants to devote more of that time to creating this AI robot.
Well, for if you go back to Neuralink for a second, so for Neuralink, one of the actually now they're actively looking for clinicians for the human trials. So here's another question that I have. So as people, if we are trying to get people live longer, one other issue that they're maybe missing is these people, they are not prepped to live longer. You see what I mean? Like if someone is like, let's say, 77-year-old, and now we are going to tell this person you'll be able to live another 15 years, and then you'll have a really good life. Like that's not going to happen. So how is that going to happen? I don't know. Like if we don't have that preparation, and we already know that we have these, these issues with the nursing homes, and then I really don't know if that can happen, and I'm just kind of like not sure if someone should not be working on that side of it. Now, it's great to do that quality of life, but then we have Medicare problem. Now you're going to say, well, come on, what the hell you are talking about? But I'll tell you. Now, when you have Medicare patients, we are paying for Medicare, right? So the idea is someone is going to be retiring by the age 65. So what people don't understand is what we are paying for Medicare is not enough. So, and right now, Medicare's budget is one of the biggest budgets in the government institutions. And as Medicare is already not enough, so what's happening is now we are going to actually increase that life expectancy, which is great. We are increasing the quality of life. Well, I would love to do that for my own parents. And that's great, right? So, but what if people are not prepped to live longer? Now, I was at one of the pharmacies the other day, and the cashier, actually not pharmacies, one of the department stores, I guess, the cashier was at least 80 years old. And I'm not lying. If you go to Macy's, you'll at least spot 2 or 3 people, cashiers, at least 75 to 80 years old. We can go together and then can count. And then the reason they are doing that is not because they are bored. They are not looking for for fun. They need to pay their secondary insurance. They need to pay their bills. They need to pay the simple basic stuff. And when the issues like that, if we are not taking care of that problem, I don't know if just investing on technology by itself to improve the quality of life is not enough. So like yes, they will live longer, but they will be so poor. Mm-hmm. So work on together to increase change the expectation, not increase anything, but change the expectation so people don't feel like they can actually retire at age 65. Because when that was set up, Sean, so you probably, I'm not that old, I don't know that. This is the baby boomer time. So when this age 65 set up, life expectancy was not what it is today.
Right.
People were dying before age 65 when that was set up that time. So there has to be something parallel with this. And I do hope that people can see this part of it. And what Elon Musk is doing, great, but it's missing the actual human part of it, the social, so that it's not just the technology. So who's going to use the technology and what that technology is going to do to the people, what impact it's going to have. So all that has to be done together. So I want to actually stop here if it's okay with you, because we have the bariatric event coming up at 3, and with some of the changes we have, we have for the bariatric Friday as well with Dr. Erkan. So I'll try to do that. So I don't know why people are talking in front of my office. So I'm going to call the Canadian truckers to just.
Yeah, they'll get the job done. They'll come and push them out of the way for sure. Yeah. Just on that point, how you were saying though, with people, having to prepare, I know it actually it clicked a little memory. One of the funny, in my opinion, there's an E-Trade commercial, which obviously is encourage investing, and it's the theme in the song is I'm 85 and I want to go home, because these people are actually having to still do laborious jobs as they're, like you're saying, 85, because you're not preparing this long life expectancy, like you're saying. It's going to come back to bite you at one spot or the other. So as you're saying, with the technology advancement, obviously it's a great thing, life expectancy increasing, great thing, but also we have to take into account many other factors as these innovations are coming about.
Definitely. And I think there's more to do. And I think with the health organizations like ours, the partnership with the technology companies is the only maybe solution. So if they can work with us and we can actually connect them with real life scenarios and patients and how we are working with, we do population health management. So if you just dismiss what's happening in real life, technology by itself is not going to get us anywhere. So I'm hoping that maybe he'll answer our request to meet and actually work together. Well, Sean, thank you for joining me today, and we'll be back again on the next Friday session.
Of course. Yes, thank you so much for having me. Have a great rest of your weekend.
This weekend. Bye-bye.